Wow, wow, wow. Isn't that stage amazing? It's so good to be back here, I have to say. I wasn't here last year, but I'm super happy that this year I made it to Skopje, and this time we're going to talk about health innovations. So if I look back at the last couple of years, I see two major things that sort of triggered the development of digital innovations, and one of those is obviously COVID. So, sorry, I was running upstairs, so I'm kind of breathless now. I'm so excited. Yeah, so let's say I'm so excited, but I'm actually breathless. You know, when you oh, that would be actually amazing.
In the meantime, I have an objection. I mean, it was very unfair to put this session after all these beautiful brains and beauty. So, Andrew, next time before the award.
Yeah. But you know, you all guys had lunch a moment ago. So now I very much hope that you will be also participating together with the panelists, and we're going to have a great session. So going back to what I was saying about those trends that I see over the last couple of years. So obviously COVID was number one, and I want to ask you who. Back in 2020, when COVID or lockdown started, who of you actually used telemedicine for the first time ever at the time? Oh, so you are the predecessors of all those who started using, because if you look at the McKinsey data, you will see that just between February and April, the number of people who used telemedicine actually grew 78 times. So I'm glad to see that all of you actually used that before that. But if I translate that into the Central and Eastern European experience, you can see that there's a Polish startup that actually became a unicorn back in 2021 because of the scope of services that they offer, which is actually online appointments. So the other thing that I see being a trigger of digital health innovations is obviously AI. I think I've used the word or the acronym AI this year way more times than I did, in the previous years. But if I were to ask you, who of you would trust a diagnosis that you get from a doctor that was actually generated by AI, how many of you would actually be okay with that? Okay. Hopefully we're gonna get, okay, I can see some hands, yeah, also on the stage, that's great. Again, if we look at the emerging Europe region, we will see that we actually have a very interesting startup in Hungary right now. It's called AIP Labs, and they want to, they actually describe themselves, and I need to read this to make sure that I do it correctly, as an artificial intelligence pioneer building the world's leading AI engines and infrastructure, including a digital hospital. And they are quite popular, especially in Spain right now. So these are some of the topics that we're going to talk about during the panel, but I also want to relate to the future, because the COVID pandemic itself was a huge disruption for the healthcare system, and we need to be prepared for more. So that's what we're also going to talk about. So let me now quickly ask my panelists, three gentlemen. I can assure you that there are fantastic women founders in the health tech domain as well, but today we just happen to have three gentlemen. I'll ask them to briefly introduce themselves and give us a little bit of the context, how you guys are linked to the healthcare system. So I'm going to start with Igor in the middle.
Thank you. My name is Igor Tulevski. I'm born and raised in Skopje, Macedonia. I'm a cardiologist and the founder of Cardiology Centers of the Netherlands and Heart for Health. My connection to medicine is obvious. CCN is a private-public organization, and we are the biggest supplier of cardiovascular care outpatient clinic in the Netherlands. We have 14 clinics in the Netherlands, but we're expanding abroad. We have Canada, Serbia, and we are developing in Croatia, Slovenia, Poland, and Romania at the moment. The idea is to become the biggest cardiovascular platform worldwide. At the moment, we see about 300,000 patients annually, and digitalization is basically the solution because, to my most sincere opinion, I believe that healthcare is a social right, and access to care is a social right. And the only way to face the pandemic which we have in demand in healthcare is to make healthcare scalable. And the only way to make healthcare scalable is by digitalization. So, being a hardcore cardiology company, we decided 15 years ago to become a digital company as well. So we do have a big portion of our activities are in the field of IT.
Perfect. Dalibor, can we?
Hi, so I'm Dalibor. I'm the CEO of Sourcex. We are a Macedonian-Australian company. Not many people know it, but Macedonia actually has a fully integrated medical record. The system here is called Moj Termin, and the same thing was taken up in Serbia. So we have taken the ideas and essential learning that was developed here and exported it to the world. We currently have national and private customers in Australia, New Zealand, Canada, Croatia, and South Africa, soon to be Namibia. It's the market over there. And we're intending to expand to the United States this year. I fully echo Igor's view that digitization is the only way to get the right scale in healthcare. And, you know, it was a good point about AI. I mean, there is a conflation right now of aging populations, of a general dearth of cadre coming through sufficient to manage and to deliver the services needed by today's healthcare systems here in, you know, emerging Europe, as you term it, but just globally as well. And we have to make it digital and we have to make it automated, and that's what our company does.
We're going to talk about Macedonia's role in that, you know, healthcare ecosystem as well, and what kind of, you know, what kind of role can play going forward as well. And the last one, but not least, Arber.
So I'm Arber Shehu, born and raised in Kosovo. Actually, I spend most of my time also here in Struga. I know who is from Struga here. So my mom, she's from there. Is that staying kako Struga nema druga or ima druga? Yeah, great. Ima, nema, okay. So I completed medical training in Kosovo, and then I moved to the United States to complete my master's at James Madison University. And then after that, COVID hit, and then I moved at Johns Hopkins University, Pulmonary and Critical Care, working closely with CDC and the White House to provide them biweekly recommendations for the public health after the COVID cases dropped, fortunately, and then I moved to a biopharma, to AstraZeneca. My role is to help the team to fight the cancer as a cause of death.
Fantastic. So we're going to start by, or I'm going to start by asking you about the trends that you think are really essential in what is going to drive innovations in digital health globally, in Europe, and also in Macedonia. Anyone wants to start?
Well,
Igor. Okay, go ahead.
being in the field, facing patients almost every day, I mean, what we see is that the hospital as a concept is outdated. In former times, in hospital, you would enter the hospital and there are two ways to get out, alive or dead. But in our days, we are so good in hospitals that we keep people alive. And we are getting older, but older with a lot of comorbidity or diseases. Meaning that the pressure in the hospital is fully changed from inside of the hospital, outside of the hospital. Because on one side, the entrance, the access to care, the demand in diagnostics is unsufficed. But on the other hand, with every treatment, and we do thousands of treatments every day, we create a new chronic patient which will stay in the hospital until the rest of their life. And the hospital as a concept is not made to serve this demand. So, and as I said, healthcare is one of the most important pillars of every society. And as I said, I truly believe that it's a social right. So access to care will increase the demand, the demand in digitalization. Basically, digitalization is the only way to meet this demand. So it's a necessity.
So how do you feel about this digital hospital that I mentioned before?
Well, again, it's a necessity. We run a virtual hospital. We don't call it digital, but virtual hospital for many years, and it was basically generated by the need to serve all the chronic patients, because there is a big mismatch between the demand and the supply. And in cardiology, that's the most beautiful part of medicine. You cannot wait for cardiologists for 6 weeks. I mean, if you can wait for cardiologists for 6 weeks, you probably don't need one. So you need your service now. And when we treat the patients after they becoming chronic, we make appointments with them in six months or a year. But when they have complaints, they go to the emergency room, which is a very inefficient and very stupid way of working. So basically, the human body is a source of biodata all the time. And we have to bring this body to a silo called hospital, and somebody in white coat has to tell you what the readings are. But on your iWatch or any other brand, you have more data now than we had in our coronary cardiac unit 10 years ago. So basically, if you combine this development in the technique with a bit of digitalization, there's the answer to your question, Andrew. It's a necessity. A virtual hospital is the only answer where we can help patients with two hands, not on one patient, or with two hands on thousands, if not hundreds of thousands of patients.
Thank you very much for that, Dalibor.
I might dive in here. I fully echo Igor's views. I mean, the way I'd say, because we try and sell, in the sector, and I have to work on the marketing a little. The move has to be from fixing to management. Like you say, if you can wait 6 weeks, you don't need to wait at all. The problem is to get to a point where you never even need to be within the 6-week window. So all of these data have to be processed somewhere, and the way that this is managed in digital healthcare to date generally has not kept up. Digital healthcare has been a digital tool next to a device. Igor has the right idea to move all of this out into people's watches and devices. I wear a smart ring, partly as market research, to see what the future holds. At some point, we are all going to be generators of telemetry. And no one is yet ready in healthcare. These AI models have nothing to train on. Most historical records are paper. The best and most long-term structured medical record in the world, and this will surprise you, is here in Macedonia. Because for 12 years, every single diagnosis and referral and prescription in this country has been attached to structured data. It's not a huge amount of structured data. There are more complex clinical processes out there. But there is actually a gold mine of data here that can be used for the initial level, before we get to the telemetry. This comes after. But the point about the global trends here, AI may get there eventually. But firstly, there is not enough to train on. We are generating it now. But also no one really knows what to do with it all the way yet. It's obvious in concept. You put some sensors on, they'll start telling you something about the human body, and so on. But there was a cultural moment in Australia recently, which I fully disagree with. They said, one of the medical colleges said, we do too much radiology in this country. We should scan people less. And I'm sitting there like, what are you, nuts? We should scan people more, much, much more. We can't. It's infeasible, it's impractical. And they said, as a medical profession, we may jump at shadows and react to unnecessary studies. Are you scientists or witch doctors? I was not allowed to say that to them. Please don't repeat that to any of your Australian doctor friends. Most of them are excellent, but some of there's this older mentality that must be replaced. Like Igor is saying, get the telemetry. You know what you're doing, you're not going to jump at a shadow. Modern medicine has to adapt to more data and more canny analysis of this data, ideally with automated assistance, because once we get these models right, they can help. Igor, I noticed you put up your hand about the AI diagnosis. I did not. I'm definitely not ready to trust it yet. But at some point, there will be enough data that you can say, not even necessarily you should do something, you should think about this. And at that point, and this is part of what our company does, you still need the plumbing that connects people up. The biggest problem in healthcare is a lack of education of patients, the ultimate consumers of healthcare. People don't react to things they should react to. They react too much to things that they shouldn't. And I see the solution as the same thing. More information, better models, and more data collection will create a point where people know what to do, are informed about what to do because there are devices on them that can provide some, verisimilitude and get the right outcome.
We're going to talk about data in a second as well, but Arber, what are your thoughts about the trends that will or are going to drive innovations in healthcare?
So I'm going to keep it short and simple. I was talking to one of my friends here, Hakif, and it's like, what do you think should I say? It's like, keep it short and simple. It's like, okay, I will. But let's think in this way. So I'm going to ask you, like, how many of you have a smartphone right now? All of you.
Everybody.
So we just need to put that health. You all have digital smartphones. We just need to add that health issue in that. However, it's more complicated in my opinion. So let's zoom out the problem a little bit. I believe that the world is very chaotic in some part. In some part, it's very stable. Societies are living in very unprecedented time. COVID hit, and we all know that. And for some part of the world, digital health is very innovative, and I wish that that can come to this part of the world in more accelerated way. For other part of the world, digital health can be something that a new norm, but the digital health, it's not a new norm, so it happened a long time ago. And I remember in medical school when we learned something like, oh, during the Greek and Roman Empire 5,000 years ago, maybe this is something that happened at that time, but maybe as a human, as a messenger. However, I believe that I'm a fan of the innovation, what you discussed. However, we have to be very careful because, for example, there is no doubt that one of the studies from the National Digital Medicine was published, which is one of the largest study actually collecting the systematic review, says that digital health has a lot of benefits. However, it will come with a lot of challenges. In my opinion, we have to welcome that, but somehow I believe that we are still in the early stage, but we have to move that early stage faster in this part of the world, considering the fact that we have to be careful on data collections, we have to be careful in the data presentation, and we have to be more prepared for the future because we already had one pandemic, but the pandemic is something that may come again, who knows? But this is not
Can happen anytime.
Can happen in any time, and a lot of other problems as well that Dr. Igor can mention in cardiology aspects. So if we welcome that in more accelerated way, I think that will be beneficial and cost effectiveness to this part of the world.
So Arber asked you about your devices, your phones, but how many of you actually have like a watch or something where you collect certain data related to your health on a daily basis? Okay, quite a few. And how many of you actually do something about it? I mean, something with the data. Show it to your doctor or, anything really. Okay, 1, 2, 3, very few. So I think, there's room for that education that Dalibor was talking about. But, I have a problem. Are there any insurance companies here, by the way? Okay, nobody wants to admit. Okay, there's one. Okay, so I have a problem sometimes with insurance companies. I called mine up a couple of months ago, and I usually do an annual checkup. I want to see, what my body looks like really, and what I should act on. And so I said I would love to set up a checkup, and they said, well, but why? Is there anything wrong? And I said, no, I just want to do some sort of prevention. I want to make sure that I do things before it gets bad. What do you think how can digital health improve that area? Because, it's time for us to do more about prevention than treatment, right? Especially that we are getting older and older and
I'll just tell a very quick story. There is a company in Australia, and I've forgotten the name, I think it's Vitality. They work with insurers. One of our colleagues has it. You wear a smartwatch, and if you've jogged and run enough or your heart rate's been high enough, they lower your premiums because you're obviously healthy and going to cost less to insure. But it's an immediate incentive for the patient. It's interesting. They get little notifications. Hey, you ran more this week than last week. That stuff matters. It helps you engage with your care, and not your care, but this is what I was saying, from fixing to management. We have to understand that healthcare is a journey with a pretty ultimate ending, but whether that journey is rocks and mountains or beautiful beachside sunsets, that's up to how you live your life and what you do.
Andrew, before you go to the next checkup, you should think of what's the most exact definition of perfect health. Do you know who is a healthy person? Somebody who has been insufficiently examined. The more you look, the more you find. So,
But I would rather find it earlier
yeah,
than later, right?
That's a very valid argument. However, as I said, healthcare is something which should be shared between everybody. And this kind of checkups are rising the cost of healthcare immensely. And one should be very careful what do you examine, because the more you examine, the more you find. But the question is whether that will kill you, because that's why you're doing it, and whether we can do something about it. And to reply in my defense why I rose my hand, what I would believe into a diagnosis established by AI, well, AI at the moment in medicine is overpromised, underdelivered. In medicine, and especially in cardiology, we have guidelines. And we spend a lot of money in research, evidence-based medicine. However, nobody ever measured how often do we use these guidelines. So I think the first step in digitalization in healthcare would be to empower or embrace these guidelines. So we generate a lot of data. And as a doctor, I'm not interested in data. I'm interested in relevant data, because a tsunami of data will only bring us more work with useless data. Most of the data will be noise. So you need systems to filtrate, to triage this data. And this is something which is very much lacking, because most of the companies will try to sell you wearables, to sell you data, but after 5 times seeing how many steps you've done, or what's your heart rate, you know it, and you don't look at it anymore. So you have to attach relevance to that. And this is an important part of digitalization in healthcare. What are we going to do with all this data? Concerning the implementation, I see the data as the most valuable part at the moment with the current technology, is using this data as a cognitive assistant. When I have a patient who has chronic heart failure, the life is too short to look at their file. I mean, they come with files of 50 pages, and fortunately now digital. So there's no way I can memorize all the relevant data in their history. So for that purpose, I need a digital assistant which will scroll this. And when I prescribe a certain medicine, will be, Dr. Tulevski, what you do is quite stupid, because this patient had this medicine 5 months ago, and it did him harm. So this is the way where we're using the digitalization, where to start using this data as a cognitive assistant. The next step will be machine learning, and we are there already. We do a lot of work with machine learning, and AI is something which is very, very tough in medicine. Why? Because of the unknown. And that was the reason why you asked this question, would you trust this? There's so much unknown in this, and the problem will be the legislation. Because for the first time in history, we live in time where the research and where the developments, digitalization, goes much faster than the legislation. So the legislative organs have a lot of trouble to encompass and to embrace all the developments. And in our case, we were far ahead, and we had a lot of trouble with the Dutch healthcare authority implementing our e-health program, because they were not used to this. And they could not place it into their legislative space. And this is something which is a big hurdle, and medicine is very conservative. So I learned not to use the AI term. You're going to use it more often, but I try not to, because every time I use the AI term with our healthcare Ministry of Health or insurance companies, I get a punch in my nose, because they just don't want. There is nobody who is responsible for that. So that will be a challenge. So we have a lot of steps to pass, which are all positive and good, and AI will be probably the frontier, which is mind-blowing.
So we've been talking about data, and there is this sweet spot between innovation and security, right? You need data to drive innovation, but you also need to make sure that all the data is secure. What I like about there's actually a very interesting project in Poland right now, driven by the Association of Hospitals, as far as I remember correctly, where patients can actually donate their data. So it's anonymous. So nobody knows whose data that is, but they can donate the data. So Arber, where do you see this kind of sweet spot between security and innovation?
Yeah, Andrew, great question. Actually, before moving to that topic, because a rector is here, right, of the university, I would like to say that education is very important, and I'm glad that three of us are here, and you live in Australia, you live in Netherlands, I live in the United States, right?
Nobody.
So, you live in Netherlands, right? I live in the United States. So, I believe that bringing awareness started with the family and education, but when I completed medical school in Kosovo, I can say like medical school sometimes is very boring. Why? You study a lot, and if you don't read any novels in your high school, you don't have time to do that in medical school. And sometimes medical school just teach you in a very traditional way. So before I fly to the United States, I met with one of my professors. Currently, I'm doing an MBA at Hopkins, and then she's a co-director for the digital health. So they immediately implemented the new curriculum to their university about the digital health. So this is what should happen in the universities and high schools here, because students who are going to be the leaders of Macedonia or Kosovo or Albania, and you name it, they have to have a knowledge about the digital health. Because I can fly here once, twice per time because I trust, for example, Gazi, who invited me here, and Nikita, so I'm here because of trust. However, we need people like young generation here to learn more about the digital health, and they to advocate for bringing the awareness and preventing the disease. It's not about just bringing young generations or bringing people from all over the world. And it's great to share experience, but I think they should start for changing the curriculum in the medical school, in high school, in nursing school. This is how it starts to bring innovation in this part of the world. Talking about the
data, but Dalibor wanted
just
to
let me
add
interject
something.
very quickly, Albert. I want to fully echo and support what you're saying. It has to start with education. And Igor, what you were saying about cognitive enhancement. Once upon a time, in ancient Roman and Greek times, as you were saying, the physician would put their ear on the patient's chest. Then they have the stethoscope. This is the next thing. And I don't think it's being treated that way. So often we deal with digital health as I need this for administration, or so I can register records to get paid by the health fund. This stuff can be of huge use. And the next generation shouldn't just learn about it, they should help design it. That will give them the power to do so, as Arber is saying. Sorry, let's get back to security.
Thank you for that. Sorry, go on about the data.
Talking about the raw data that you mentioned, I think that this in developed countries is not a new thing. It's not a new norm. It's normal that you have an official raw data and you sell it to a company and they use it to conduct some models for their future businesses, or you name it. However, with the digital health, we have to be careful, because this is one of the challenges that the society will face in the future about the data leak, data breach, because people can steal your identity. And then if you don't work closely with different stakeholders, including governments, which they can put a lot of regulations and policy in the good way. Also, you have to work with the private sectors as well in order to protect this data, because someone can steal your identity and just claim a lot of health issue to the insurance, and they can start to make illegal money because of data leak. So we have to build this raw data, selling in a legal way, that's normal, but we have to be very careful on that.
Australia's largest electronic prescription provider was hacked this morning in a huge ransomware attack, and the whole system is down. This is like hours ago. This is the 5th or 6th major incident in Australia in the last year. It's a constant risk.
Well, in medicine, we live with data, and when I treat a patient, I'm required to treat the patient according to the guidelines, and the guidelines are generated by evidence-based medicine. However, it's very challenging to get all the data, and especially in Europe, and I think that's a big disadvantage of a society which is overregulated, like the Dutch environment, because we're a too rich country and we have too much money and time to find 3 problems for every solution, and not as inefficient in a way. But for us, it's very tough to, even if the patients are willing to donate their data voluntarily, it's very tough to use it in studies. Because the studies, they have the ethical committees, and they will never allow you to use a data with a general yes. you have to have a specific approval to use your personal data to a specific study. So we do see about 300,000 patients annually, and they're all structured in a database. But to generate a study out of it is quite challenging.
I see a role of digitization here too, because one of the problems is when the records are paper, and a lot of the thinking has been around that. A general yes would mean you hand someone a file and the patient doesn't know what you can see. If it's digital, it should be possible to make a power tool to make it easy for a patient to comply with the rules, almost like a supplement to the legislation, and unlock these things.
No,
I have a very interesting question from the audience. Why the Rolling Stones members have better health than most of the other people their age, having in mind their way of life?
Survivor bias and expensive medicines.
Anything to add, Igor? That was an interesting question, wasn't it?
These guys are genetically different than the rest in many ways. So 25-30% of your outcomes is determined by genes, and 75 is by your behavior. And these people did everything which was wrong, but they're still there alive. And this is not the first time I'm facing this question, because when I ask a patient to stop, to quit smoking and do quick, healthy stuff, they look at me like, why? Look at Rolling Stones. So I'm still working on that answer.
Arber? You're going to pass this one. Okay. So we are obviously in Macedonia, and we know that there's been quite a few things going on here. And, taking into account the size of the country, I believe this could be a perfect place for pilot programs. How do you, in obviously digital health, how do you feel about that?
I should probably start because we're active with the ministry and the state health system. There are two gaps here, and there was recently an event by the American Chamber of Commerce where some of this is on the agenda, and I hope we will get a hearing from the, now that there's a new government to be formed with the ministry. There is a fountain of data here. It's a colossal piece of national wealth that is completely underutilized because there's no system in place yet to utilize it. Some of this is historical regulation, to go back to the problems that the other panelists have mentioned. Another part of it is that there is inadequate infrastructure in place to do this. As a functional organ within the ministry. So possibly the answer is a public-private partnership or something like this. For 12 years, as I mentioned, everybody in Macedonia has had their public, healthcare registered. This is something that, most digital health providers would dream of as a data set. And you can build services and tools on top of this if there is a mechanism for this to happen. The biggest problem in healthcare, as I see it, for the last 50 years has been funding and funding models. This has affected how healthcare has developed, the way healthcare research is conducted. There were probably better ways to do it. It's too late now. Now we have enough of there's enough great and innovative stuff going on globally. There is an opportunity to either collaborate with international companies, grow local companies. We're essentially something like this, despite our kind of connection with Australia. In many ways, we're a local company. And there's so much that can be done if there is a mechanism put in place to allow either public-private partnerships or private companies to come in and basically propose a way to work with the government, fund it, or for them to fund it with patient approval and do something together with citizens.
And are you aware of any solutions that have been developed here in Macedonia and have been sort of applied, elsewhere around the world?
Other than ours, no. Ours and Igor's, which I only found out about last week, to my great distress. We should have been talking for years. It's a missed opportunity.
The program, the HEAL program, which we use in the Netherlands, is fully developed in Macedonia. Mm-hmm. We're the biggest provider of e-health, telehealth care in cardiology. We serve whole Europe, Canada, and Australia with ECG services. So we receive about 50,000 data points every week worldwide. To my big frustration, this program doesn't work yet in Macedonia. It works in the Netherlands, in many other countries around the world, but not in Macedonia. So this is the introduction why. I hope there are no people from the Ministry of Healthcare, because there is no Ministry of Healthcare. We're in the transition. And I'm going to be very blunt and politically incorrect with this, but I do believe that in Macedonia we have to start thinking of healthcare as not a business, but as a service to the people of Macedonia. Just to give you an example, is that we have enough cardiothoracic surgery capacity to serve all Eastern and Western Europe probably. All our cardiothoracic surgeries are working with 10-20% of their capacity. And what we're going to do now, we're going to build another clinical center, which will cost probably 1 billion or something, and we're going to build more bricks. But my friends, the future in medicine is not in bricks, it's in clicks. We have, in parts of Macedonia, we don't have bandages. We don't have the essential helping tools in healthcare. And in Skopje, we're building yet another clinic with cardiothoracic surgery or whatever. So I think that we have to really start thinking about how do we want to see our healthcare in the future. And I do believe that Macedonia is a small country. We have a huge potential. You just saw this 19 brilliant students, Dalibor, Arber, and we have a potential to become a pilot, worldwide pilot as a small country, but we have to be smart on this. You asked about, you mentioned your watch. The company which is in Macedonia is one of the 25 companies worldwide which is working with Apple exclusively on the research in healthcare. I mean, how cool is that? We have a full integration with Apple healthcare kits, fully 100% Macedonian product. So we do have everything here, but we need some sense of social behavior where we're really going to start looking at medicine as a social right. And I do believe that every company in healthcare as well has to make profit. But if you want to make 50-60% profit, you should go and start selling tires or oil. Do not go to medicine. Medicine is a different economical part of the society, and you have to have a different standards.
Mm-hmm. Arber,
Yeah.
do you want to?
So I believe, like COVID shows that a lot of things. One of the things that I want to mention is all the world leaders failed to put more resources and prevent different diseases at that time and in the future. So even for Macedonia, for example, even though we are like a small country, I truly believe that we have to leverage more digital health in this part of the world. However, we have to do that very cautiously. Why? Because we don't consider it being just an experiment country without following specific rules and regulatory. If we have more resources allocated in this regard, I truly believe that this country will be a great hub and great initiative to expand actually the digital health knowledge globally. However, considering the fact that I'm always a fan of that, I don't want to compare apples with oranges. There are a lot of factors here. You have to talk about economical factor, geopolitical factor. People are eating and behaving differently. I think that if we have some results and outcomes from one study in Macedonia, this doesn't mean that the same study will be replicated in the United States or in the part of Africa or in Japan because of a lot of factors. So, but if we can do that cautiously and replicate that to the same territory, I think that we will have a lot of benefits. Considering the fact that if we use a lot of data to leverage digital health and not causing harm to the society, I believe that this is the road that we should follow.
I have one question from the audience that I'm going to change slightly. Oh, yes. What kind of health insurance system, if any, would support digital health solutions?
Well, in the Netherlands, I'm very proud to be a part of the society where 17.5 million people are fully entitled to a healthcare system. So we never build a patient, we build an insurance company. But it's a very costly system. It costs 120 billion euros per year on 7.5 million people. And I believe, and it was mentioned before, the private-public partnership is probably the best way to work because the private companies will always have the incentive to increase their profit, and the public organization will always have the incentive to bureaucratize. So a combination of both worlds would probably be the best. But to come back on the pandemic, I mean, you mentioned COVID a few times, and that's quite frustrating for me. Are you aware that smoking, diabetes, hypoglycemia killing threefold, fourfold of people who died on COVID every year? So if we want to talk about pandemic, this is the pandemic we're facing every day. We do not have to wait for another pandemic to talk about pandemics. And all these diseases, and these are the hypertension, smoking, and dyslipidemia are the mother of all the bad things in cardiology. And they're fully preventive.
That is true, because I don't want to mention that. He was going on the end. He was going to mention that on the end.
Yeah. Oh, sorry.
But isn't it because COVID was such an unexpected thing, and it's like last week I was in Atlanta in the U.S. and another shooting happened, and if you looked at the news, it was like little tiny font. Nobody really cared about it because everybody has gotten used to it. So isn't all the disease, or aren't all the diseases that you mentioned kind of like shooting in the U.S.?
Well, these diseases are 100% preventable, and what really frustrated me about COVID is that all of a sudden we had something which made us aware that we are mortal.
Yeah.
And I mean, you're probably aware that a roundabout is probably one of the most unsafe part of the traffic. And every roundabout on this planet can be 100% safe. But the congestion will be immense, so nobody wants to use that. So there is a certain level of uncertainty in life, also the checkups as well. And this is something where we have to learn to cope and live with. But in cardiology, all these risk factors are 100% preventable. COVID is not, or wasn't.
Just to go back to your question about the insurance companies,
Sure.
I'm not really into the insurance companies' policies. However, I think that they have different premiums, and depends on the insurance companies what kind of premiums they want to use it. So this depends, like which location they are, what kind of patients they have. So they can use the different business analytic models to predict the future of if you're getting sick or not. So this is something that the insurance company will decide, of course, in cross collaboration with the government or not, or if they are totally private. But to go back to yours, I totally agree, but we discussed that offline, that he will mention that in the end.
Oh.
I just want to quickly mention, and this is good learning for Macedonia potentially, although I think this is still a nascent area. In New Zealand, they're experimenting with some interesting funding models. There are other countries doing the same, but we have direct experience because our software is administering these programs. And they are deliberately funding programs to do pre-hospital care. One of them is to do with hypertension. They call it POAC, Primary Options for Acute Care, which is a very long phrase that just means you don't have to go to the hospital for this thing, go to the GP. And this is where patient education comes in. So the net cost of treating some of these things preventatively or with a smaller clinic, or as you were saying, this distributed model, is vastly lower than big facilities and big hospitals. There's no need for this. And it's net saves the system enormously. Whether that's just a renovation of public rules or a public-private partnership that connects to these things is something that can be experimented with. But this idea that healthcare should be management, and it ties to, I think you were saying about the social right. If we treat healthcare as a fundamental investment in society that allows the economy to work, people to thrive, right? The idea is to stop people being unhealthy, because then everybody benefits. And that philosophy is a big change in healthcare and a big change in how it's done. But it doesn't need to be so hard to implement. And this is where Macedonia, because of its size, can also move quickly. We can skip a few steps,
We only have literally 20 seconds, but I want to ask you one final question, which is about the challenges of the future. We mentioned, COVID happening anytime soon, or something similar to COVID happening anytime soon. What is the biggest challenge that will need digital innovations, digital solutions, literally right now? Please provide a very short answer because we're running out of time. So Dalibor, go ahead.
In Macedonia?
Sorry?
In Macedonia?
No, in general. But you can relate to Macedonia if that.
Legislation.
Yeah, legislation and funding models, and they always go hand in hand.
Arber?
I'm not very familiar with the legislation in Macedonia, but I believe so as well. But I think, to go back to your point, the non-communicable disease, such as cardiovascular disease, it's something that Nikita should consider that in Macedonia 2035 or 2045. It's like mental disorders, non-cardiovascular disease, as well as climate change and health. These are all things that we can use and leverage digital health in order to provide better outcomes for the patient and society. Because one thing we should consider, healthcare is a national threat if we don't invest in that.
So let's stay with that thought for the rest of the sessions today. Thank you guys for joining me on, for this particular session, and a round of applause for them. Thank you so much.
Thanks, guys.